Good morning. I'd like to welcome you to our session this morning. I would like to thank everybody who is able to join us this morning. We're going to go over some of the COVID-19 information for businesses and employers. This information was created in collaboration with the Kenton Hardin Health Department. And Kelsey Ralston will probably not be speaking today, but she did work with me to put this information together. So this information was put together in cooperation with Kelsey Ralston, Public Information Officer at the Kenton Hardin Health Department. I'm going to go over the information from the health department first, and then we are going to discuss the impact of the current COVID outbreak on business. Here's the contact information for the Kenton Hardin Health Department. Their website is hardinhealth.org. And then their contact information is on the left. We will discuss it later, but people who have questions can contact the health department at khhd@hardinhealth.org. That way your message will get through, even if a phone call may not immediately get through. So the contact information for them is shown here. They are currently working out of the Emergency Operations Center located in the Sheriff's Department that is closed to the public, and that is for the COVID response. Their office is still open for some of their regular services. So recommended strategies for employers to use now. One of the main things that the health department is encouraging is if anybody is showing symptoms of illness, they are recommended to stay home and not come to work until they are free of a fever. The threshold that we're looking for is 100.4 degrees or greater. Any signs of a fever, any sore throat, or difficulty breathing would be the typical symptoms of the COVID-19 virus. And so we want to make sure that anybody who has those symptoms are staying home and helping to reduce the potential spread of the disease. As an employer, some of the things that the health department is encouraging is to reevaluate sick leave policies, make sure that they are flexible, and that you're being consistent with public health guidance that's coming out. Make sure that you're working with your temps. A lot of temp agreements include attendance requirements within their initial period with a company. So make sure that temps are incentivized to stay home as well if they are sick, and that you develop non-punitive leave policies for those temp employees. Don't require a healthcare provider's note if they have acute respiratory illness. For them to be absent or for them to return. It's really about the symptoms and that fever threshold. And then maintain flexible policies to permit employees to stay home to care for a sick or family member. We get into this more later, but now that we have some of the schools have closed, we want to make sure that people are able to care for family members, especially if there's illness present, and we want to be flexible as we can. The CDC is currently recommending that anybody who have these symptoms of illness be sent home immediately to separate them from your other employees. Emphasize staying home when sick, respiratory etiquette, and hand hygiene. So there is information on cdc.gov. There's posters that you can download. The staying home when sick, cough, sneeze etiquette, and hand hygiene. And employers are encouraged to increase the number of tissues that are available and no-touch disposal receptacle for employees to use. They can cover their cough or cover their sneeze and then dispose of it in a no-touch fashion. Everybody's already heard this, but hand sanitizer is good. The health department is still emphasizing washing hands with warm water and soap for at least 20 seconds, washing palms and the backs of the hands between the fingers, just good hygiene. And we're encouraging employers to make sure that there's plenty of soap and water in addition to the hand sanitizer available for your employees. Routine environmental cleaning. I know a lot of our businesses in the area have already stepped up their routine cleaning, especially focusing on frequently touched surfaces in the workplace and providing disposable wipes. Here's a graphic that was put out that just kind of spells out everything that the CDC is recommending currently. We touched yesterday in our session on this coronavirus or COVID-19 about travel. Um, there is currently no travel ban for domestic travel. However, we are encouraging that businesses postpone any non-essential travel and to really watch the CDC website for travelers' health notices because these situations are changing very quickly. Anybody who has any symptoms should check themselves or self-report any symptoms before they start to travel and notify their supervisor immediately um, before they would get into a public travel situation. Everybody is encouraged throughout this time to contact your primary healthcare provider. Give them a call and ask their advice. That's a good resource for information. There are hotlines available, but your primary care provider is still a good resource to give you advice on what you should do given your particular situation. They are letting people know that if you are already outside the United States, um, be aware that embassies, consulates, and military facilities are not really able to support people who are showing symptoms or to evacuate people back to the United States. So before you travel, be aware of that. And if you are currently outside the United States, just stay aware of what the local guidance is for what people should be doing to seek support. Additional measures in response to the currently occurring sporadic importations of the COVID-19. CDC does offer a how to conduct a risk assessment if you feel that you may have been exposed to COVID-19, how you can conduct your own risk assessment for your potential exposure, and if employee is confirmed to have the COVID-19, what employers need to do to inform fellow employees of their possible exposure. Directions would be given by the health department when they are working with a person under investigation. So if you believe you've been exposed, contact the hotline and they can give you specific directions for your situation. Yesterday in our presentation, we discussed guidance for preparing workplaces for COVID-19. And I know that employers are feeling really like now is the time, or maybe yesterday was the time, to put together their plan to respond to this. OSHA has put together a great guide for employers to use to develop their own plan. Some of the planning considerations should be reducing transmission between your staff, spacing out whenever possible, moving desks apart whenever possible. One of the things they're talking about now is adjusted shifts, moving employees, maybe start times and end times so that you can reduce the concentrations of people who are together in one place. Making sure that we're protecting our employees who are at higher risk, maintaining business operations, and minimizing adverse effects. So those are things to think about when you're putting together your plan, because maintaining business operation and minimizing adverse effects on other entities and their supply chains are also important. And we want to emphasize that today. Key considerations when making appropriate decisions or to decide your appropriate response is disease severity and impact of the disease. So keep in mind that this is a serious illness and we are trying to just minimize the impact on our country as a whole. I'm sure that employers are seeing this now, but be prepared for increased absences, either due to illness in family members, employees themselves, or due to childcare issues because of the dismissal of the K-12 schools. Monitor your absenteeism, be prepared to track the reasons why people are missing and be able to validate that. Cross-train your personnel to perform essential functions, and then assess your essential functions and the reliance that others in the community have on your services and products. Be prepared to change your practices so that you can continue to operate. Employers with more than one business location are encouraged to make sure that a local manager has authority to make decisions based on their locality. This is important when there's multiple satellite locations of a business. We want to make sure that the local manager has enough authority to make a quick call to quickly protect their operation and make policy decisions that are needed. Coordinating with our own state and our local health officials is strongly encouraged so that timely and accurate information can guide appropriate responses. I know that the local health department issues guidance. Usually they will watch any press conference with Governor DeWine. They will watch for his new directives and orders to come out, and then they will issue local orders based on what is coming from the state level. So they will not always be able to communicate directly with every business. Kelsey and I discussed this yesterday. You may need to seek that information. They have a website. They also have a social media presence, and they are working to keep their social media updated on Facebook, because that's the quickest way that they can get information out. Important considerations for creating an infectious disease outbreak response plan. This goes back to the planning that I kind of already discussed. There's also a lot of this really goes into what your health department and how your health department formulates a plan and how they issue their directives. So be aware of this, but have your plan ready. Implement strategies to protect your workforce. Touching again on what we went over, ensure the plan is flexible and your employees are informed. Make sure that you've had a focused discussion or even an exercise using your plan. It may be actually time to implement your plan depending on your operation. But try to find out if your plan has gaps or problems that need to be corrected. Share your plan with employees, explain what human resources policies, workplace and leave flexibilities, pay and benefits will be available. Share your best practices with other businesses in your communities, especially those in your supply chain, chambers of commerce, associations, to improve community response efforts. Question came up yesterday in our session. We currently have not had anyone share their best practices or their plans with us. However, the OSHA guidelines really do give employers a good starting point for what they may need to do. When we talk about your supply chain and sharing your best practices with them, that may include making sure that your delivery drivers are also symptom-free and healthy, making sure that if you implement a self-scan for temperature, or if you're scanning your employees for temperature, this would mean making sure that any delivery drivers or people entering your plant also get scanned and are following similar precautions. Visitors may be limited to your campuses at this time, or they may also need to be screened before they can enter. So that's what they're talking about. If you're implementing best practices, making sure that those get rolled out to visitors regardless of their reason, who are coming to your work location. So identifying work-related exposure, reviewing your human resource policies, exploring whether you can establish policies and practices such as flexible work sites. So I haven't talked about that yet, but telecommuting is really becoming a popular option if you're able to offer that. Flexible work hours, staggered shifts, anything you can do to increase physical distance between your employees to comply with those social distancing guidelines. Identifying your essential business functions. So being aware of the non-essential business functions and having a plan for need to reduce workers in the office, what is essential and what is non-essential. Set up so what is the authority, triggers, and procedures for you to implement your plan. Knowing that ahead of time will help you when that time may arrive. And then again, they're just emphasizing the social distancing. If we can comply with this now, my hope personally is that we can reduce the duration of this impact, and so that we can get back to normal operations more quickly. Have a plan to communicate information to your employees that is efficient and effective. Work your best to be flexible now that the schools are closed, and realize that the local conditions influence the decisions of public health officials. So there is national guidance, there's statewide guidance, but what we need to know is exactly what's coming out at our county level and try to stay informed of that. So we covered this with the travel, but they really want people to consider canceling non-essential business travel to those targeted countries outside the United States. But even domestic travel, we need to consider limiting that. And then making sure that we're engaging state and local health departments, confirming their channels of communications. So the Facebook page is their quickest way that they're able to get information out. They have been sharing a lot of information with our office so that we can communicate to the business community as well. But being aware of our local regulations is going to be important. You've probably heard that they've banned mass gatherings of 50 people or more. There are exclusions to this. So there is a link on the Ohio Department of Health website to all the orders that have been put out, and it is worthwhile for businesses to be aware of what those exclusions are. Right now, I know there's an exclusion for weddings and funerals. They are providing expanded guidance regarding, does that include the reception if for a wedding, or the luncheon for a funeral. Currently, they have ruled that it does include the reception and a meal that may surround those events. There are exclusions surrounding business, factories. The schools are closed, so that exclusion is null at this point. Restaurants, we know, are impacted by the carryout or delivery only order right now. Groceries and retail stores are exempted so that people can continue to resupply. This is the graphic that they are using regarding social distancing, the reason why. Without social distancing, the number of cases in the United States may exceed the capacity of the healthcare system. So they're trying to flatten the curve, reduce the number of people impacted so that they can make sure that everybody has access to the care that they need. Currently impacted businesses, we kind of went over this: restaurants, schools, bureaus of motor vehicles, salons, nail salons, tattoo parlors, Ohio Department of Natural Resources, lodges. Libraries are closed. However, they are encouraged social distancing. They are supposed to encourage social distancing, and individual library branches are making that call on their own. So guidance from your local library would be coming from each individual branch or operation. And then one of the new best practices for businesses is taking temperatures of your employees before they report for their shift. Stay informed. We put together this slideshow a couple days ago. Some of it feels outdated or behind the 8 ball. So be aware and stay informed using the official information sources. Do we have any questions in the chat, Jesse?
I have just added several links.
Okay, so there are several links in the chat. If you have any questions about this part of it, please enter those in the chat. I'll do my best to answer them. But I would like to move on now. The reason that I would like to have you all together is the economic impact conversation that we would like to have. Excuse me. Here's a list of questions that have been put together by one of my resources at the state level. They are collecting information because they would like to be able to compile this to make decisions about how to move forward and offer resources to businesses who have been impacted. So some of the discussion questions that I would like to put together are, what has been the impact to your business from the coronavirus? Closure, reduced hours, sales, clientele. What would the anticipated impact be if current concerns continue for 2 months or 4 months? What are your immediate concerns? What are your long-term concerns? What measures are you taking on your own to maintain operations or reduce impacts? After we return to normalcy, how long will it take for you to recover or return back to typical business operations? What are your most pressing challenges now and longer term? What types of assistance would be most helpful to you at this time from the state, federal government, or from Jobs Ohio? And then are there any other questions or concerns that you would like to share? So I'm going to open it up. I'm going to open the mics now. Anybody who would like to talk will just have to be cognizant of each other and take turns. We do have a survey that we shared on Facebook, and we shared it in our constant contact email a couple of times, but there is a survey. If you would like to enter some of this information into our survey, we'll be able to record that and submit it to Jobs Ohio and to our state government, our local government, through the results of that survey as well. So with that, I'll unmute and we'll see if anybody has anything that they would like to share. Okay, I'd like to start off. I could have Jesse start by sharing what we've done here in our office, what has changed for us.
Good morning. So we have done a few things in our office that has allowed us to ensure that we are embracing and following the directives put by the governor. First of all, we have started by making sure that now our lobby is closed. At the beginning of the week, we were working where people were stopping into the office, and we were finding that some of those visits were non-essential visits. Things that could be done by phone, operating via email, and therefore we have closed our lobby, ensuring that our staff within our office are not having any type of exposure from somebody who might be just popping in. But this also allows for us to keep our distance from one another. We have also personally, I have been accommodated with working from home. So I work in the morning from 8 o'clock to about noon. And then in the afternoon, I'm able to work from home and to be with my children to help them their schoolwork done, and to make sure that, we have the time needed to be away from this. Other things that we've implemented is cleaning. So each one of us has wipes located in our office, and we typically have the first person that comes in the morning wipes everything down, the light switch, the door handles, the bathroom, coffee, all of those things, so that we can ensure that we start our day in a very clean workplace. Holly, can you think of any other things that we've done?
I think that covers it pretty well. I think that covers it pretty well. Trying to just limit our exposure to each other, limit our exposure to non-essential visitors. We're lucky here because we have a small workforce, so we're able to be spread apart physically. It was an easy thing for us to do, and it just made sense. I know that the suggestion was monitoring employees' temperatures. What we've done is self-monitoring here and self-reporting. We all want to stay healthy and keep each other healthy, and so we're doing self-monitoring at this time. And that has really given us all a peace of mind too, in the office, just to know that we're on top of it and that we really are paying attention to our own health. Does anybody else have anything that they would like to share?
Well, this is Sonia from Graphic Packaging. So if you can hear me, Jesse did ask me to talk a little bit about what we're doing here.
I appreciate that. Go ahead.
Okay, no problem. So here we, of course, do have a large workforce, and we are continuing to work. So we've done all the things that have been requested of employers, things like, making sure that we're doing extra cleaning, extra sanitizing. We've put up lots of information for our employees on how to keep themselves safe, and of course, asking them to make sure that they're washing their hands for the 20 seconds, and we have hand sanitizing stations all over the facility for them to use in between when they're able to wash their hands. We have asked for them to do the social distancing as much as they can, but I guess some people aren't as concerned about it, so they do still sometimes get in groups and talk and things like that at break and all that, but they are, I guess we do offer it for them in the workspaces. They are pretty spread out, so they're able to do the social distancing. With the recent request of the governor to do the temperature checks of every employee, we are working on that. We do have thermometers on order, the kind where you just touch the person's forehead with it, to limit, I guess, the amount of touching that we have to do of our employees. So we're working on getting a process in place for us to be able to do that. For those of you that aren't really familiar with graphic packaging, we probably would be one of the last places to close, because we are considered an essential business because of what we do for the food service in the U.S. So with us making, between all of our cup plants, we make about 30% of all the cups used in hotels, restaurants, fast food chains, etc. And our carton plants, we make about 40% of the boxes that go on the shelves in the grocery store that food is put into. So we will continue to work. We are still hiring. So if anyone is displaced from their position and they do need to come to work to make money, we are still hiring, and we're just going to continue to run as normal as possible, and at the same time follow all the guidelines. We have continued to be flexible with our employees, for example, not giving points if they're sick and switching their shifts and things like that if they're having issues with childcare because of the schools being closed. So we are trying to make sure that we keep as much of our workforce as we can while we go through this as well.
Thank you for sharing that, Sonia. Yes.
Yes.
It's Lou. I just wanted to commend you guys for these calls, and thank you, Graphic Packaging, for sharing those things. I think we're going to see maybe some of the workforce issues correct themselves while others, struggle. But I wanted to share with you some of the things some of the other areas are doing, And one of them is the chambers are starting to post new job openings, for the needs that are going on right now. I just wanted to let you know that.
Thank you. That's
Lou.
a great idea.
Yeah. And also I did want to state that as far as the economic impact goes, we probably won't know for quite a while. For us right now, like I said, we're trying to continue to operate as normal, and our call-offs really haven't been much higher than normal either. But customers may start cutting orders and things like that with not having, people being able to come into the places to eat and things like that. So it'll probably be a little while before we're able to see what the economic impact is on us.
Okay, thank you. I think that's a good suggestion. Anybody who does have any hiring going on right now, please let us know. We occasionally are able to share those types of opportunities on our social media. However, right now, that would be a great way for us to focus our social media efforts. So anybody who does have anything, please send those to me or to Jesse. Our common email address is alliance@hccba.com, and that's the easiest way to get things to us unless you already have one of our email addresses. We would be glad to share that information because it's important to get that out right now as people are increasingly looking for work. I do know we will see economic impact on the industries that have been specifically given orders through the governor's office. And so anybody who represents those industries as well, please fill out the survey. The link is in our chat log so that we can record that, because those are significantly impacted. And I am glad to hear that there are industries that have been deemed essential. I know that a lot of businesses may be wondering whether they fit that essential qualifier or not. So it is good to know that they're including the whole supply chain in those essential businesses.
Holly, sorry, this is Lou
Yes.
again. I had another
okay.
really good idea. Speaking on the chamber side, and I sent the sample to you. There are chambers saying here's ways you can help the small businesses. One, of course, is to buy a gift card online, shop online if you can with them, and also I never would have thought of this, but leave a Facebook review, leave a Google review, anything that you can do to help lift them up, and specifically the salons and spas and restaurants. And, you can prepay your your next appointments and just things like that.
That's another good one. We did discuss that in our office yesterday, and even small businesses that have a Square and have a Facebook page, if they get creative, they could offer those gift certificates or pre-buy options for people who are currently still able to support them. And then I think that's a great idea to reach out to maybe your stylist or to your salon or to a small business, maybe a boutique that you frequent, and see if they have the ability to do an online transaction for you, even if it's through Facebook or kind of creative means. I'll wait just a couple more minutes if anybody has anything they would like to share about the impact to their business or questions that they may have. Okay, I want to thank everybody for joining us today. We will post this recording so that people who are not able to attend live will be able to see it. I will probably clean it up a little bit, do a little bit of editing before we post it, but we do want to share this so that we're getting the information out as well as possible. And again, I just want to reiterate, check the chat box, take that survey. That is a way that we are able to collect the information so that we can get it to the decision makers that need to know what the impact is as of right now. And we will leave that survey up for a while so that as the impact starts to become more apparent for other businesses, they're able to add their feedback. Thank you again for joining us, and I hope that you all have a safe and happy day.